Now on to Dr. Amy Sullivan. So excited to have her. She's the Director of Behavioral Medicine, Research and Training for Cleveland Clinic Mellon Center for MS. Dr. Amy Sullivan is board certified health psychologist and Director of Behavioral Medicine, Research and Training at the MS Mellon Center. She's an invited member of wellness research through the National MS Society. She and her research team are the 2015 recipient of the Robert J. Herndon Award for Most Outstanding IJMSC article. Dr. Sullivan was also the recipient of the CPA Outstanding Early Career Psychologist Award and was named an extraordinary graduate of St. Bonaventure University, where she played Division I basketball. In addition, she's passionate about physician self-care, burnout, diversity and leadership, and psychological health, and is the Director of Engagement and Wellbeing in the Neurological Institute, where she works to improve physician well-being in her institute. She's also the co-chair of the Women's Leadership Team. She is the director of the FRAME Education Program for the Internal Medicine Residency Program, where she works to help students understand their worldview, resilience, and emotional intelligence in the practice of value-based medicine. Her presentation is Managing Our Emotions During Uncertain Times.
Well, thank you so much, Mindy, for that wonderful introduction. And I also want to thank you so much for inviting me to participate in your real star-studded, empowering day of education. It's so exciting to be here. And I also need to share a bit of gratitude to Dr. Boster, who I know suggested me and really believes in the holistic treatment approaches for people with MS. So I'm just honored to virtually be here today among some of the greatest minds in MS care. I do not see my slides up, so I'm waiting for those to come up.
They're coming.
There they are. Wonderful, wonderful. All right, so I wanted to start by just giving you a little bit of information in terms of why I decided to do this presentation on managing our emotions during uncertain times. So I think we all feel the same way, that the year 2020 has been unprecedented in a number of ways. In 2020, there have been natural disasters, there's been a major political divide, therefore a human divide. I feel like the human divide is at an all-time high, and we're in a global pandemic. 2020 has really changed our thoughts, our emotions, and our routines. Limited social interactions have really shaken our sense of safety and perhaps increased anxiety, sadness, disappointment, hopelessness, and grief. These are all very normal responses, but they're very difficult to manage. So taking care of ourselves, especially in utilizing holistic and wellness approaches, is essential in helping find normalcy and well-being. Go ahead. And you will see this slide again, but I really feel that this is important to conceptualize what my talk is about. So these are our pillars of well-being. They're activity, both mentally and physically, nutrition, and rest, meaning both sleep and shutting down our sympathetic nervous system, which is our anxiety and our response to stress. And instead learning how to turn on our parasympathetic nervous system response, so rest, relax, and recover. And this is something that I'll show you throughout the course of our presentation today. Go ahead. Go ahead. So I wanted to show this slide because I think it's really important to understand the high prevalence rates of mood disorders in our MS population versus the general population. So our MS population is in the orange, and the general population is in the green. And so what you're seeing, the first is depression. And so depression occurs in about 50% of MS individuals, and that's about 3 to 4 times the rate of depression in the general population. Next is anxiety, and I think anxiety is very difficult to measure because anxiety can be measured via state or trait, but in this study I found anxiety was at 36%. We have adjustment disorder at 22%, bipolar disorder at 13%, and psychosis at 3%. So just important to share the high prevalence of mental health disorders in the MS population. And remember, these are disorders. So this does not mean, this is not accounting for just symptoms of depression or anxiety. Okay, go ahead. So what we're looking at now is emotional health during a pandemic. And so as I had shared earlier, I think it's very normal to have waves of emotion. So at some point, people will say to me, well, I feel really grateful today because I'm healthy or because I have a job. And then in the next breath, they're feeling very uncertain. They're overwhelmed by information. They're sad from social distancing and not seeing people that they typically want to see, feeling isolation and loneliness, which is one of the major things that I'm seeing with my patients with MS. And so we then created a virtual support group that has gone over very, very well in terms of helping to connect our patients to each other during this very uncertain time. There's also economic certainty. We're noticing that there's decreases in well-being, and again, there's that word again, and psychological health. There's also increases in uncertainty, depression, anxiety, and stress. Go ahead. And so when we understand that mental health issues, they can really add to the burden of MS, and this can impact mood, relationships, function, quality of life, medication adherence, and decision-making, and at times suicidal ideation. Go ahead. This is one of my favorite pictures. So what we understand about stress is that it doesn't just impact your mood, it can impact your entire body. And so what this picture is showing us are the effects of stress on the body. So stress can impact our mood, our cognition. It can impact our cardiac system, so blood pressure, heart rate, cholesterol, and the risk for heart attack. The immune system, so there's a reduced ability to fight and recover from illness, which is really important now. GI system, so stomach cramps, reflux, and nausea. Our sexual system, so loss of libido, lower sperm production, increased period pain for women. Our bones and our joints, so aches and pains in the joints and the muscles, and lower bone density. Okay, go ahead. So I think it's important for us to understand that when we see that our mood is really starting to impact us, it's important to seek professional help. So what I mean by that is when we see that there's loss of interest in things that one used to enjoy, that our mood impacts everyday activities such as being with our family or our jobs, or how we respond to events, or managing our diagnoses and our health. When it starts to impact function, quality of life, and relationships, again, it's time to seek help, and certainly when you have suicidal ideation. Okay, go ahead. So when I think of treatment considerations, I really believe in the multidisciplinary approach to managing our MS patients. So we really manage the whole patient. And so this really reminds me of the parable of the blind men and the elephant. So many of you may know this parable, but it's really one of my favorites. So this parable states that there were blind men who saw an elephant for the first time, and each of the blind men felt a different part of the elephant. Thus, their truth was in what was being, so what they had felt and what they had experienced. So one blind man felt the trunk of the elephant and said, well, this certainly is a snake. Another felt the leg and said, no, this is a tree. Another felt the ear and said, this is a fan. And another felt the tail and said, this is a rope. And finally, another felt the body and said, this is a wall, and so on and so forth. And the men got into a large argument about what their experience was and therefore what they believed. And so a wise man comes in and hears them arguing, and he shares with them that all of their experiences are correct, but that they needed to put their experiences together to truly understand the elephant. And this is really a similar belief to how I believe we take the best care of our MS patients, by each provider being a specialist in their specific area and putting together what we completely understand about the patient and the person. So these are some of the things that we do in behavioral medicine. So behavioral medicine is a form of treatment that focuses on the psychological nature and needs of the patient. So some of the things that we do are called cognitive behavioral therapy, and I will talk a little bit more about this in the next slide. Another thing that we focus on is the grief acceptance and adaptation model. And so this helps us to kind of conceptualize the MS diagnosis and the MS path for the patient, because initially they are diagnosed and then maybe they start to understand the disease and start to accept where they are with the disease, and then maybe they have a relapse, and it's time for them to kind of go through this acceptance and adaptation model again. We teach behavioral therapy, and that's really important for people who have stress, so shutting down that sympathetic nervous system or that fight or flight nervous system. As I shared earlier, we have several group therapy sessions that are now all virtual. They range from a men's MS group to a young professionals group to a caregiver support group to an MS process group. And we make use of community resources. Go ahead. So I wanted to spend a little bit of time on cognitive behavioral therapy. So many of you may have heard this before. So cognitive behavioral therapy, or otherwise known as CBT, really focuses on the relationship between one's thoughts, emotions, and behaviors and how they all intersect on mood. So it's relatively short in terms of treatment duration, and there can be different modes of delivery. So as you know, the world has changed, we've also changed the way that we deliver. And I would say up until a month ago, 100% of our care was delivered virtually. Now we have about 2 patients a week that want to come in, but most of our care is delivered virtually. And we can incorporate some behavioral strategies such as relaxation, stress management, breathing, visualization, and mindfulness techniques and interventions. And it can also be delivered in group format. So I'm a big fan of cognitive behavioral therapy and creating a tailored approach for each individual patient. Okay, go ahead. I think it's also important to share a little bit about pharmacotherapy. So some of the pharmacotherapy classes that we use for mood disorders are the SSRIs, and these are really recommended as first-line treatments because they have the fewest side effects. There are some potential medication interactions, and there can be some side effects. The SNRIs are recommended before the use of TCAs and MAOIs, and there are also some potential medication interactions, but these are used for people who also have pain in addition to mood symptoms and anxiety. And then there are the benzodiazepines, and these are widely used as a fast onset of action, and they have proven effectiveness. However, there can be some side effects associated with those, such as excessive daytime sedation and confusion, and it can lead to dependence. Okay, go ahead. Okay, so now we're going to focus a little bit of time on specific recommendations for coping with anxiety. So first and foremost, wellness is imperative. And so I promised you that you'd see that image again. What's really important is for us to learn how to maintain a healthy diet, to move or exercise regularly, to have a routine, to practice some form of spirituality if that's something that's important to you, to understand full well-being, and so that includes psychological well-being, and to sleep. Okay, next. My second recommendation is to take a break from media. I think it can really draw us in, but it's really important to know that it can stimulate you as well. So it's important to disconnect from the media. It's important also to stay informed from a trusted source. So maybe one 30-minute block in the AM and one 30-minute block in the PM, but not to have it on all day long. It's also important that we protect our children and our elderly from incorrect information or overwhelming information, and that we provide our children with age-appropriate information. So a lot of information is coming out in the news, not just with regards to COVID, but there's been other things that I think are really important for us to monitor and protect those who are the most vulnerable. Go ahead. Number 3 is getting sleep and resting and recharging. And so one of the things that I suggest is not watching something that stimulates you. So for some, it's news media and within a 1-hour time frame of going to bed. Limiting stimulants, so such as alcohol and nicotine before bed. Consistently staying on your normal sleep-wake cycle, so that includes the weekends as well. Understanding that if worries creep in and create insomnia, you can have a worry journal right next to your bed. So reaching out, grabbing that worry journal and just writing down your worries and dealing with them in the morning. And then perhaps having a wind down time with a bedtime routine, with a bath or a cup of tea. Okay, next. This is probably my favorite. So connecting with others. So in a safe manner, connecting with others. So reaching out to
Your
family.
Your name is?
Hi.
What's your name?
Can you mute that,
Amy.
please?
Hi, I'm Leah.
Hi.
Nice to
Can
meet
you guys mute that line? Thank you. Particularly those that we know are isolated. So maybe sending a card, a FaceTime, a Skype, and just becoming creative and connecting with those that are really important to us. All right, go ahead. And finally, we're going to focus on stress management techniques. So breathing techniques, visualization, mindfulness meditation, if necessary, seeking mental help if worries, anxiety, isolation, grief become unmanageable, and creating coping projects. So things that you can do maybe with family members or a loved one. Some of the things that we've done with people across the miles would be like, we created a scavenger hunt that we could all do together, but we did it virtually. So doing things from, a creative stance. Okay, go ahead. So now I'm going to spend some time really teaching you about the importance of the mind-body connection. And so what I'd like to do, you can go to the lemon. What I'd like to do is I would like for you to spend some time visualizing with me. And so pretend that prior to coming here today, I went to the store and I got some really juicy lemons. And I'm going to cut the lemons and they're juicing and oozing with juice. And I'm going to give each of you a piece of my lemon. And what I'd like for you to do is put that lemon in your mouth and bite down on it. And just notice what's happening in your mouth. Okay, go ahead. Go ahead, Lorraine. Next, I'm going to give each of you a piece of this aluminum foil. And I want you to crumple up this aluminum foil and dig your fingers into it and just notice what's happening in your body. Take that aluminum foil and put it into your mouth and bite down on that. And just notice what's happening in your body. Okay, next. Next, if your house is like mine, you come home and there's all these Amazon packages stacked up. Next. And inside, maybe some styrofoam. And so what I want you to do is I want you to break apart that styrofoam, stick your fingers in it, hear it, feel it. And if you want to, take that styrofoam and put it in your mouth. Okay, and last slide. And the last one in mind body is this chalkboard. And so if I were in front of you, I want you to pretend that I have very long fingernails. And I'm gonna take them and I'm gonna scratch them down the blackboard. Okay, stop. And what I want you to do is really just to recognize what was happening in your body as I was giving you these photos. And so as I was giving you these photos and you were probably experiencing some physiological reaction to the photos. Now, recognizing that none of these stimuli were actually in front of you, but you were still having that physiological reaction. That is because of our memories and the strong mind-body connection that we have. So I just wanted you to buy into that for a second. Okay, Lorraine, go ahead. So we're going to end today by me teaching you something. So what we're going to do now is I'm going to, if you would like to engage with me, I'm going to time you for 1 minute, and all I want you to do is breathe. So I want you to put your feet firmly on the ground. I want you to get in a comfortable position. And I want you to close your eyes, and I'm going to pick up my cell phone so that I can get to my time. And I would like for you just to breathe. Just breathe as if you're being calm, as if you're focused on your breathing, okay? And I'm going to time you for 1 minute. So count your breaths, okay? Go ahead. Okay, stop breathing. And what I want you to do is just keep that number in your head. So first, I have to mention, as a psychologist, I think it's very appropriate to do experiments on you guys. So hopefully you enjoy this experiment. So I want you to just keep that number in your head of how many breaths you had in 1 minute. But the first thing that I want to ask, and I know I can't interact with you, I wish I could, but I've done this before, is what that 1 minute felt like. So were you in the camp where you were like, this is the longest 1 minute of my life. I can't believe how long this takes. And after this, I have to go to Target and prepare dinner for tonight. Or were you in the camp where you could completely focus on that 1 minute of relaxation? So I will share with you that most people are in the first camp where it's very difficult for them to focus for even 1 minute. And that tells you about us as Americans and how fast our lives are and how common it is for us to have our sympathetic nervous systems revved up. So that picture I showed you before of the stress, to have our sympathetic nervous systems revved up and really doing damage to our bodies. So now I want you to think in your head about how many breaths you took. So if you had more than 15 breaths, or if you were between 10 and 15, or between 6 and 10, or under 6, okay? So I have some bad news just based on the fact that I've done this a number of times throughout my 10-year career. And that's that most of you were probably above 6 breaths per minute, which in my field is hyperventilation. And so I want to share with you that this is something that I can help you change. And so there is some good news associated with that. So if you flip to the next slide, I'm going to teach you a breath called the diaphragmatic breath. So the diaphragm is the large muscle located between the chest and the abdomen. It's that U shape underneath your ribs. This is an area that stimulates relaxation response. It's also loaded with lymph nodes, so that it's important to pull fresh air into there and then pull it out. So most of us breathe from the chest. So we breathe these short, choppy breaths from the chest. And what I like to teach in my practice is how to pull that breath into the diaphragm. And so if we had time today, I would really teach you that diaphragmatic breath. But I can tell you that if you're somebody who does yoga, or you're somebody who sings or plays a wind instrument, or is a runner, you probably know that deep diaphragmatic breath. If not, then it's something important for you to work on just by figuring out where your breath is coming from. So the chest or the diaphragm, and learning to really pull that breath down. Okay, next. This is our final slide today. And so what I want to do today is walk you through an exercise that I guarantee you will decrease that number, that first number you had for 1 minute, and will decrease it to 6 breaths per minute. And the reason I know this is because this is called circular 3 breathing. This is something that I created to help my patients drop their breaths to 6 breaths per minute. And so this is a 9-second breath. And so what you're seeing in front of you is that we inhale steadily for 3 seconds, we hold steadily for 3 seconds, and we exhale steadily for 3 seconds. So a 9-second breath. So what I'm going to do is, if you're willing, again, is I'm going to restart the clock for you. I want you to get in your comfortable position again, and I'm going to walk you through the first cadence. And then I want you to continue that cadence yourself, hopefully having a 9-second breath. So therefore under 6 breaths per minute. Okay. All right. So we're ready to begin. In, 2, 3, hold, 2, 3, out, 2, 3. Continue. Okay, stop. So if I were with you, I'd want to know your feedback in terms of if this was an easier 1 minute to breathe through, or if your mind was still going askew. What I find is that when I give people something to focus on, this becomes a much easier way to focus. This is also a way for you to do a relaxation or something that's good for you when no one else knows that you're doing this. So I've taught this to my colleagues at the Mellon Center, and I know that they're doing this in tough meetings. I can observe their breath, and I can observe the hold. And really, the hold is a special part of the relaxation process. So that's really where the magic happens, as I call it, because most of the time we breathe in, out, and we don't take time for that hold. And as people get very advanced in this skill, this then turns into a square. So they inhale, they hold, they exhale, and then they hold again before they breathe. And it's really spectacular to see how this impacts their physiological functioning. So we connect people to what's called biofeedback. And so we can read what's happening inside of their bodies physiologically inside of their bodies by way of teaching them these techniques. So I hope you enjoyed that today, and I hope you can take that with you and just do something fun. I wouldn't advise doing it driving or anything that could be dangerous, because it really can help to relax you, but take that with you. So I know this was a very brief presentation today, and I covered a lot. And so I wanted to give you a short period of time to ask any questions that you may have, and you know, I'm here to answer those. Yeah, and so I see somebody saying already that circular breathing was much better. So what I teach, we teach a 4-session stress management protocol at Mellon Center, and it starts with a diaphragmatic breath, and that can typically be very difficult for people. I like that breath as the first segment of our stress management because it really helps people to ground them and to learn how to breathe differently. But this does not tend to be the favorite of our 4-session stress management session. In fact, what I just taught you is, and so thank you very much for that comment. There are a lot of other components to it from a behavioral perspective, as I shared earlier, that we teach, but this is one of the most popular components. And I also love the comment that your mouth was watering when you were looking at that lemon. And I imagine it was probably reacting when you had the aluminum foil or the styrofoam or my nails scraping. And so again, remembering that these were not actual stimuli in front of you. You were not actually feeling them or putting them in your mouth, but this is based on a memory. And so I think that's really important too. There is a question in the chat about mental health help for children with MS and how parents can help deal. And so I think that's a really important question. So most of who, we treat are families. So we treat, we've had patients as young as 3 years old in our offices with their parents so that they can clearly understand the mental health aspects and the physical health aspects. I think they're both difficult. And so I think finding a good psychologist is really important. So from our perspective at the Mellon Center, we are licensed in Ohio. And so we are able to see people from all over the state of Ohio. However, our societies have given some freedom from the perspective of what states we can see right now, given the global pandemic. And so we've been able to see patients from really almost all throughout the country. So if you're interested, we can certainly help you with that. The Blackboard made you cringe. Yeah, I know, right? It's even worse if I'm in there with you and I actually pretend that I'm doing it. The circular breathing slide again. Can you go back to that? Okay, there's the circular breathing slide again. So the goal is that you inhale for 3 seconds, but it's not a quick inhale. It's a slow, steady inhale. So it's a 1, 2, 3 inhale. Then you hold for 3 seconds, and then you exhale for 3 seconds. And so you should be breathing. This should be about a 9-second breath. So the National MS Society, so the question is, who should we ask to find psychologists who can help our family with my MS, our family help? So the National MS Society has a program called the Navigator Program, and in there it lists all mental health providers who are interested in MS care. And so whatever area you're in, you can get directed from the National MS Society's Navigator Program. And the final question that I'll take, because I realize I'm out of time, is, does the breathing help you fall asleep better? Absolutely. We use this for insomnia as well. And so many of our patients have fatigue related to insomnia, and fatigue related to multiple sclerosis, and fatigue related to depression. So fatigue tends to be something that's very difficult for our patients, but there are things that we ask our patients to do. So with fatigue management, it is learning how to take a brief nap during the day when we figure out when that works best. And so when we teach people how to fall asleep very quickly, and these breathing skills are part of that. So thank you. Thank you all so much.